In this video, I'm going to talk about how we treat depression and anxiety at Brisbane Natural Health. Hey guys, my name is Katherine Maslen. I'm a naturopath, nutritionist, author, and the founding director here at Brisbane Natural Health. And in this video, I wanted to share with you the approach that we take when somebody comes in to see us for help with anxiety or depression. So the reason I bunch anxiety and depression together is they're both mood disorders, and basically the treatment protocol and approach that we take would actually be very similar, just the treatment that we're using might have that little bit of difference in it. So I'll talk about that a little bit. So basically, if a patient's coming to us and they have mood complaints, so they're anxious or they're depressed, or perhaps they even have self-esteem issues or other things going on, there's a number of different things that we have a look at. To begin with, we want to really assess the severity of what's going on, and we need to make sure that if we are dealing with anxiety or depression that is really severe, that we are working with your health professional concurrently. So if you're already on antidepressant medication, etc., the last thing we want to do is for you to come to us and we're going to immediately take you off that. One of the aims that we'll probably have over time in conjunction with your doctor is to try and reduce that dosage and potentially get off that medication if you're able, but it's not really our primary thing. The primary thing when you're presenting to us with anxiety or depression is to really help to boost you up to get you feeling good again as quickly as possible. So there's a number of different ways that we do that. So when you're seeing our naturopaths, what happens is we're going to be looking at, are there any nutrient deficiencies that are compounding this? So for instance, if you are deficient in B6 or zinc, you won't make as much serotonin and feel-good hormones that you need to. So if you're deficient in magnesium, you're going to be more prone to anxiety because you're not going to be able to make the neurotransmitter GABA. So we're going to look at that type of thing. We're also going to have a look at your sleep and what's going on with that, because if you're sleeping really poorly, it's going to be exacerbating everything that's going on for you. We're going to take a look at stress in your adrenal glands. So the adrenal glands are little glands that sit on top of the kidneys like this, and when we're stressed and anxious, they actually pump out stress hormones which actually exacerbate things further, and it keeps us in what we call a flight or fight response. So particularly in anxiety, it means we're going to be on edge and have problems with that all the time. So in addition to that, we're going to use specific herbal medicines that we know are anti-anxiety and antidepressant, okay? So, the most common one you might have heard of is something like St. John's wort. So St. John's wort has a couple of different actions. It works on your nervous system, it's great for anxiety. It also has antidepressant effects, and it actually helps to increase serotonin like the medication does, but without the side effects. We have a number of different herbal medicines that we might choose for you based on what's going on for you, because if you're on medication, there's going to be certain herbs that we're not going to be able to use, so we're going to make sure that that program is safe for you. But herbal anxiolytics and antidepressants work very, very quickly to actually calm down your nervous system and lift the mood, so it's going to help that little bit too. Now, the other thing that we will look at doing is referring you to our emotional wellness team, because it's never just physical. Whenever you have anxiety, depression, it is never 100% chemical. There's always going to be an emotional attachment with that, and if we just treat the chemical, you're going to be feeling great, might even get off your antidepressants, but what will happen is we haven't dealt with that underlying emotion. It's going to come back again, and a lot of you that are watching this video and have experienced anxiety and depression would know that, because you'd notice it from these recurring episodes throughout your life, and it just means you haven't really dealt with the underlying issues there. So what we will do is looking at referring you to our hypnotherapist, our holographic kinetics practitioner, or our kinesiologist, and depending on really what you need, and they'll actually go through a process to actually uncover what are the emotions attached to this and what's actually going on in the subconscious mind. So only 10% of your mind is conscious, 90% is subconscious, and the subconscious mind is what drives our belief systems, which drives our behavior and our emotions. So it is really important that we do the beautiful herbal medicine in combination with this emotional wellness, and we get fantastic results for our patient by combining those two. So if you do want help with your anxiety or depression, please call our team on 07 3367 0337, and if you have any questions at all, don't hesitate to ask.